Great. I'd like to open up questions to the audience, if I may. We have a number of people with
Sure.
their hands raised. So I just want to go over just a couple of things. So we don't take questions directly from the chat. Instead, we ask everyone to raise their hands. If you're not sure how to do this, you'll go to the button second from the right at the bottom of the Zoom. It's called Reactions. You're going to click on that, and then you'll select Raise Hand from the pop-up window. When I call on you, I will unmute you and prompt you to state where you're from and to ask your question. And please keep your questions brief and on topic. And with that said, we are going to go to Rochelle. Rochelle, please state where you're from and ask your question.
Hi, can you hear me?
Yes, we can.
Hi,
Okay.
Rochelle.
Hi, Dr. O'Malley. So I've been in the past to biomimetic dentists, and I was wondering if there's a criteria to be a biomimetic dentist, because the dentist I went to was like, not to quote somebody I don't like, but it was like drill, baby, drill. And he, there was nothing biomimetic about drilling down teeth and then crowning them, because I had fillings in those teeth, and, the fillings had to be replaced. So I was wondering the criteria. The dentist I'm going to currently, I absolutely love. I think he does phenomenal work, but he does core buildup. Is that the same thing as biomimetic dentistry?
I would say it's, Rochelle, it's great questions. It's hard to tell what they're actually doing there. I've lost my picture here somehow, so I'm going to try to get back.
I can see you.
You can see me?
Yeah.
Just, I don't know what kind of computer you're on, but you can just look for the Zoom in the taskbar
Yes.
on that.
We back?
Yep. Okay. Did
Good.
you have anything else?
Yeah, I heard the question. Thank you for that question. It's hard to tell. If you go online, go to the aobdm.org website, and you'll see what we consider to be some of the criteria and some of the training and some of the courses, some of the sponsors, mentors, etc. You could also see if the dentists have signed up in there, because if they do, they make a pledge that to the best of their ability, they'll apply what they've learned in biomimetic dental seminars. It's the best we can do because we're not a policing type agency, but we put that together to try to help with it. Now, in my practice, you'll see I do core buildup on almost everything. So core buildup's just it's a computer generated procedure that has a dental code attached to it. So if a person's using insurance and things like that, they can attach it and send it in, and they may get some payback from that from the insurance company. The core buildup is just a fancy way of saying we build the tooth back up in layers underneath if we're putting an onlay on it or something else on it. Now, even when I'm doing a large, we call it a direct restoration, meaning I'm directly fixing it that day. I'm not sending it to the lab. Many times I also put a core buildup. That's just indicative of me taking the time to build things in layers. And then I do the final biofill on top of that, which is also in layers. So it's just a way for me to be compensated for the excess time. Rachel, if you gave me a little bit more information on that, I could probably answer the question better. So he's doing a core buildup, and then what?
A core buildup and then a crown.
Okay, is it a tooth you had a crown on before?
There's a lot of teeth. It's a tooth I had temporary crowns on, and the previous biomimetic dentist just drilled it down and gave me, temporary crowns. And this dentist cleaned it all up, and he's been doing core buildups on those teeth, but he eventually plans on crowning it.
It sounds like you're on the right track. So when he's doing the core buildups, are they root canal teeth already?
Some are, some aren't.
So the procedure is a little different on the root canal teeth, on vital teeth, living teeth. You would be able to tell they won't take a material and kind of place it, and then they're done with that buildup. They have to do it in layers.
Right.
Are you aware? Is he doing that? He or she doing that?
Yeah, I mean, the dentist I'm going to has a fabulous reputation, and I I feel really, really confident with him. So I trust him, but my question was really about the criteria, because I've been to a biomimetic dentist and, it didn't mean anything because he wasn't what he said.
Yeah, I mean, it'd be, someone saying they're probably, a foot specialist, and they took one seminar on something about feet, and they didn't even apply what they learned, and
Mhm.
so not to belittle this whole situation, but I think that's the hard part for people that are searching around. So you can look at the credentialing and say, where did you do your training? Who did you study with? And then you can look up those people, because you'll find out there's only a handful of people, maybe 15 or so worldwide, that are really known for training and teaching biomimetic dentistry. And then, it doesn't always mean that they're going to do it. Once they learn it, doesn't mean they're going to do it exactly that way, because I know some quote unquote biomimetic dentists, and I'm just going, wait a minute, they're not even doing this buildup. They're not doing this. What's happening there? Well, they might be at the infancy of their learning curve. So I give them the benefit of the doubt, but that's one way you can research it. Just ask where they got their training and how long have they been doing it. You could even say, how has it changed your practice? And
Thank
you'll
you so
see
much.
they'll come alive with that question. Okay.
Thank you so much for your answer.
You're welcome. Thank you, Rachel.
Right. Our next question is going to be coming from David. David, please state where you're from and ask your question.
Hi, Doctor. I'm David from Massachusetts. I have
Hi,
two
David.
questions. Hi. Thank you very much for your great lightning presentation. I have two questions, please. One, I have three tooth extracted because they had root canal. And by the time that I wanted to do zirconia implant, they said that there is not enough bone. So they wanted to do bone grafting for me that made of cow bone. And I was a little bit suspected that maybe there is better alternative than putting in my body something that made of cow. I wanted to understand what is your opinion on this. And my second question is regarding if you're familiar with Photoelectric Ionic toothbrush that should kill the bacteria in the mouth, and what you're thinking about this. Thank you.
Sure. Thanks for your question. I appreciate that, David. As far as the bone grafting, you just want to see someone that has a lot of good statistics and history with bone grafting. There's a lot of different materials out there. Sadly, I'm just not an expert to tell you about that, but you could reach out. I'll give you the number to someone out here that you might be able to send an email to them, to their office.
Yeah.
If you bear with me, I'm just looking it up right now. Yes, there's a number you can call. It's a periodontist down in Southern California, but their number is 310-826-8242. And they'll give you the website. You could probably even do the research on there and see. But those are good things. I mean, you want to make sure what kind of materials they're using. A lot of these bone grafting materials, they're meant to be like a scaffold to allow the cellular matrix to build up over and rebuild the bone. And some is actually like a block of bone in there. So, your question is well thought out. I think if you call that number, they'll give you the information you need, David. Okay.
310-826.
Yeah. Go ahead.
310-826-8242, correct?
Yes.
Okay.
Got it. And then the Photoelectric Ionic tooth cleaners, spin brushes, etc. I'm in some research with that now, even with my company, Great Oral Health. I'm looking at what are truly ones that actually do what they say they do and no hype behind it. Some of these are marketing hypes. So I don't really know. I do know that if you brush with a glycerin-free toothpaste, you'll decrease the photoelectric charge to the plaque that's always harboring around. So, you won't create a negative charge right off the bat. So There may be some science to it. I'd have to look at the science to see. I don't think it's going to create any harm is the main thing.
Yeah. Thank you so much, Doctor.
You're welcome. Thank you for your question.
Okay, our next question is coming from another David. David, please state where you're from and ask your question.
Yes, so my name is David. I'm from the Washington, D.C. area. And
Hi,
I was first curious to know, instead of implants, what do you think of flippers or bridges, flippers being false teeth where you remove them? And the other is, as far as dental material, do you have a general recommendation of what dental material you would use for fillings, or do you just use the Clifford test and ask your patients to first do that and then determine the dental material? But generally speaking, which material do you think is a good one to use for fillings?
Okay, so going back to the first one on the flippers, you can also test for those materials too on the Clifford test. There's another test called Biocomp. I'm not a big fan of the Biocomp because of their computer model sometimes ends up negating some really good materials. And it's just because of their computer model. And so you end up sometimes using inferior materials, but the Clifford test is good. It's on pause for about a month or so. Another company bought it and they're working their way through a few of the challenges with it. So flippers are quite a fine option, I think, short term until a person decides if they want to do any type of dental implants, plan it out. They can see, gosh, if they love the flipper and they're able to function with it and it's just they're happy as can be, you can continue with it. Now, the challenge with flippers where there's missing teeth, et cetera, it depends on how big the space is. Are there teeth supporting it on either side? Or are there no teeth in the back and it's a big flipper? There's a lot of things to look at prosthetically, because if you're putting a flipper in where there's, let's say there's no teeth in the back, over time, it'll push on the gum and that bone, and it'll cause the bone to sort of melt away over time. So, and then it can torque on the good teeth. So those things have to be looked at long-term. Short-term, I think it's a great and viable option. Now, as far as the dental materials, I use a material called APX and Majesty Flow. Those are my main go-to. And then adhesive called OptiBond. It's a gold standard adhesive. Has some of the highest, what we call bond strength. So first we clear out the decay, and then we lay a bond layer in there, adhesive layer in there. And if that's not real strong, no matter what we do, even if we build in layers, it's going to fail. So this is a really, really good material, OptiBond, and it tests generally in the 98th percentile of the Clifford tests. So in my practice, I might get 1 or 2 patients in a month or every 2 months or so that test negative to it. And then there's some other alternatives that we can play around with.
What do you think of the bridge, though? What do you think of the bridge?
A fixed bridge?
Yeah, instead of using an implant, many practitioners suggest doing a bridge, I guess, where it's something that you go between 2 teeth and you somehow hook it together. I'm not sure how it works.
It's good as long as the span is not too long. If the span is too long, you can put a lot of pressure on those anchoring teeth. But that's what we did. We've done for 100 years. We've been doing those, and they can actually have good success. The problem is the teeth that you attach to, if it's a long span, you have to grind them down as if you're doing a crown.
Oh,
And they all have to draw properly so that that bridge has to slide over both teeth at the same time when you cement it in place. So you have to end up whittling down those teeth a bit. Now, that's one traditional way of doing a bridge. There's another type of bridge, which is a bonded bridge, and you can do it in the front. If you go on my videos, you'll see I even have a bonded bridge right here in the front. This tooth is missing, and I bonded it on the back side. It's a certain type of material, which is very holistic. It bonds on the back side. It's anchored in, and it probably will never come out because we have 14-year studies with those. And I can floss. It doesn't even have to connect all the way to the other tooth. Well, we can do that in the front, but in the back, we need a stronger material. But sometimes we can bond those to the adjacent teeth in the back. The problem is they're weaker. If they break, then you just have to pay for another one. But if you're ultimately not wanting to cut down your teeth, just ask for a bonded bridge and tell them you'll assume the risk, and you should be good to go if there's a tooth on either side.
Thank you for that. Our next question is coming from Yvonne. Please state where you're from and ask your question.
Hello, I am Ivan from Mexico, and I have some brief questions to Dr. O'Malley and a recommendation. Is it okay?
Yes.
Okay.
Fantastic.
Hello, Dr. O'Malley. Are you planning to write a book about your work? Does xylitol have the same effect as a Trojan horse with gut bacteria? Have you tested the bioavailability of your products once they are X-rayed when they cross the border? Do you have a way to clean or detox the plastics inside the mouth and the body that mimics estrogens? Do you take care of the multiple effects of these and other materials used by traditional dentistry in your clients? And the recommendation, do you beam light, ultrasounds, and electrons at the same time to cure the tooth or the cavitation? If you don't, you have to check the beamer that dissolves cavitation in the bones, invented by Dr. Andrew Hage. His site is cellsonic-medical.com. If you beam the infections with his invention, you can kill selectively all the bacteria in minutes, even inside the microtubules without tissue damage. That's all.
Wow, that's fantastic. I'm not familiar with that. I love that. What is the email of the Sonic Beamer?
I lost his email, but the site is cellsonic-medical.com. And the doctor is Dr. Andrew Hage, Hague. He has been severely censored by his invention. It beams the three kind of rays inside the bone even. Light in the form of profound laser, ultrasounds, and electrons. It's the same principle as the lithotripter of the stones in the body.
It makes sense. I love it. I can't comment on that one. Wow, you have a lot of questions here. So
yeah, I'm sorry. That's why I asked
answer some of these. Sure.
You want to pick one or two of them?
Am I going to be writing a book in the future? Yes,
Yes.
I will be. It'll be in the next 3 years. I'll be putting a book out of some of my adventures. I'm going to try to make it enjoyable, fun, and educational. Right now, I just have a standard book that I wrote with my business partner, Tom Sirocco, on hygiene care and some of the history of hygiene and dentistry. It's on the website, thegreatoralhealth.com website. You can get one for free. I think the exchange is that you give an email and you get the free ebook, which is some 140 pages of good information. Then your second question was something about, is silica as good as something with a xylitol? Did I get that right? Because it broke up a little bit.
If the xylitol is a Trojan horse inside the body with the gut bacteria, the same way it is with the oral bacteria. If it hurts the gut microbiome, our microbiome eats it, thinking it's some kind of nutrient, and it's killed by it.
Yeah, my understanding is in the gut microbiome. Well, anyway, if you take too much xylitol, it can upset some dysbiosis and diarrhea and things like that. So, what I have in my product, of course, the toothpaste, you don't need to ingest the toothpaste at all. But what I know theoretically is in the oral cavity, the bacteria, basically, they just run out of energy trying to digest it. So they die naturally, allowing the other beneficial bacteria to come in, because we don't want to have the main strain is Streptococcus mutans and Sobrinus. We don't want to have a preponderance of those in the oral cavity. If so, throw a little bit of carbohydrates and a little bit of refined sugar, fruit juices, etc., and they're off to the races. So this kind of calms that down and slows it down, and especially for cavity-prone patients. So I don't know. I hope that's answering your question somewhat. I haven't heard of any I haven't heard of any stomach upset or anything with the toothpaste products. Secondly, let's see, your next one.
The plastics of the
plastic.
traditional materials, do you have a way to clean them from the body? Because they mimic
the only way that I know is the only way I know is an old Indian kind of thing, and it's a sweat out. It's sauna. Might be from infrared sauna. Just sauna sweat out can get some plastics out, from what I understand. Now, I haven't done the studies on it or the research on it, but with the dental materials now, you can get fully BPA free. I think there's another BP in there. They can be really, really more on the holistic side. The best is not to get any dentistry done at all, prevent it all from happening. But in our world, at least we're fortunate enough we can save teeth, whereas before people actually died or wish they had died from tooth infections because they were so severe. So at least we don't have to suffer that. But plastics, I think, is sauna and sweat out. That's the only way I've heard of how they can be potentially eliminated. Okay.
Yep.
Then
Just have one more minute left, just so you know.
Okay. What else? What was your next question that you had?
About the bioavailability of your products once they are X-rayed when they cross the border, because I live in Mexico.
Okay, so once they're X-rayed, so what might happen to the products? Would the irradiation wipe out the bacteria, wipe out the beneficial bacteria? You know, I don't know. It's a darn good question. I'd have to find out. I don't think it'll harm the toothpaste or the essential oil. It might make the probiotics less viable. But I honestly, I don't know.
All right.
I'll tell you, it's easy to find out. You use it, and if you feel a beneficial effect, you would just continue using it, because if it irradiates and wipes out some of those bacteria, you're still going to get enough that it should be beneficial. I don't think it'll transfer the radiation effect to the body, hopefully.
Right. Thank you so much, Doctor, for your, for all of the answers. There is extremely informative. So thank you. Please open up or unmute the audience. And
Thank you so much. It was really great. Very informative.